Hi, my name is Chris Borak, and I am one of the behavior consultants for the district. And today I wanted to talk about reinforcement based toilet training. So, this program is created by Al Fat and Dr. Frank Cicero. I have not seen Dr. Fat present. I have seen Dr. Cicero present. He's a local guy. He's affiliated with the Eden 2 Genesis programs. He does a lot of work with issues with people with autism, issues related to bathroom, sexual education, masturbation, things like that. So they do have some prerequisites for you to consider before starting a program like this. Most of them are pretty straightforward. One is that the child have the ability to sit appropriately in a chair for 3 minutes. The next one is that the child can go approximately an hour between urinations at times. It doesn't have to be all the time. Basically, what they're looking for here is that, for some kids, as soon as they get any pressure in the bladder, they eliminate immediately. So if that's the case, and they don't recommend a program for that child at this time, they want to have some ability to control it and hold it a little bit. Um, the child should have some basic self-help skills. So things like, lowering their pants, pulling their pants back up. While some assistance is okay for that, they want to be able to do it with that assistance. That's important. They want to be able to physically access the toilet, climb on and off it if need to, things like that. They should have some basic contingencies of reinforcement, some basic understanding of contingencies of reinforcement. So basically, that first end language, you do something, you get something kind of stuff. And then they should ability to moderate unsafe and interfering behavior. As you'll see as we go through this, you're going to be spending a lot of time in the bathroom, and the bathroom is a lot of hard surfaces. It can be slippery. So if you have a child who engages in high rates of tantrums, or aggressive noncompliance, or just physical aggression in general, self-injurious behavior, you want to try to work on decreasing some of that before taking a look at this program and starting it. So some other considerations before starting: increased fluid intake is part of the plan. You're going to be, what they call flooding the child with fluids. So that's always a conversation you want to have with the doctor before starting any kind of toilet training plan like this. You want to discuss the best types of fluid to increase, discuss the amount of fluid that can be increased for a child your age and size and whatnot, because that's going to be different for everyone. Any concerns that the doctor has that you should keep in mind as you're progressing with that. Always good to have a conversation with the doctor before starting this kind of thing. So the training setting, while you're doing your training trials, you're going to be spending a lot of time in the bathroom. As you get set up, the bathroom should be in sight for the duration of your training sessions. You can set up right outside the bathroom. The authors really would like to see you inside the bathroom if possible. So you said bring play items, leisure items, things like that into the bathroom if it's big enough. If it's not big enough, then you can't do that. Then you're as close to the bathroom as you can be for the duration. Um, Ideally, the bathroom would be for as much as possible, make it exclusive for the child that you're toilet training during the toilet training time. So whatever your setup is, just want to make sure you can keep the child in sight, be able to immediately view if they're having an accident. As we go through this and we start talking about procedures, you want to just be close to the bathroom. You should not be on the other side of the house. The bathroom should not be out of sight while you're doing the training. Some additional environmental considerations are that toilets should be the appropriate size for the child to access. So if you got a little one and you're working on it and they need like a little stool or something to get up onto the potty, whether they're standing or sitting, make sure that you have that on hand. You want to make sure that if they are a little one, they're going to be sitting on the toilet. If you would need one of those inserts to make the opening a little smaller for them so they don't fall through, make sure that's ready to go and they're used to that and they know what it is. If you are going to be standing because the child has a hard time sitting and you're going to be using any kind of splash guard, basically all your materials are on hand, including toilet paper, things for washing hands, towels, all that should be ready to go when you get started. So your child's attire, this is a big one. This is important. This is sometimes where parents decide that they're not quite ready to do a program like this. Your child is not going to be in a diaper or pull-up during training. So you may have been involved with toilet training procedures in the past where maybe they're in a diaper and then you take them every half hour to go sit on the toilet or stand at the toilet and then they go back in the diaper and then you bring them back and forth every half hour. This is definitely not that program. While shorts are acceptable, the authors say that underwear is ideal because you're going to want to be able to see in view as soon as an accident starts. Shirts should not be long and they should not be thick. Waist high is ideal, a little bit below the waist, but you don't want to be blocking that underwear area because, like I said, you're going to want to be able to view their shorts or view their underwear and be able to see when an accident starts. Some medium colors like gray works really well, like orange works really well in terms of colors because those are light colors, and when they get wet, they turn dark. So you can kind of see it right away. And it's the first time you start doing it, and the first time you spot an accident as it starts, it'll show up as just like the faintest little dot, but you'll see the color change on the clothes. So if you can avoid like white, because white can be harder and take a little bit longer to see those kind of changes and spot an accident. And I do recommend staying away from long pants. That makes it really, really difficult to see when an accident's starting. In terms of the fluids, you're going to keep fluids on hand and readily accessible. You're going to have free access to the fluids that the child likes. Remember that you're going to talk to your doctor about levels and what types of fluids to use and how much could be too much if there is too much. But the additional fluids, the reason that they say to flood, so to speak, is to increase the teaching trial. So think of this as any other teaching trial. If your child is an ABA learner, you've seen them do trials probably in the past, and so the number of trials it takes for them to acquire skills sometimes, whether it's sight words or numbers or letters or sounds or colors or shapes. Sometimes it can take a large amount of trials to be able to do this and to be able to learn. So with the toilet training, you want to have a large number of trials as well. So increasing the fluid intake makes it more likely they're going to have to use the bathroom again. It increases the number of teaching trials. And the authors go on to suggest that the average typical level of fluid intake for many kids is just not sufficient enough to create enough of those teaching trials. And then they recommend cutting off fluids approximately 60 minutes prior to ending the training session, and that will help the student kind of get back on track to what the normal typical level is. So determining reinforcement. Remember, this is reinforcement-based toilet training. So what you're using for reinforcement and how you're delivering reinforcement is going to be very important. The reinforcing item must be something that can be delivered immediately upon success, in the moment, right there on the spot. So you're not going to be taking a trip to 7-Eleven if they do well and they eliminate in the toilet. You're not going to be going out outside in the backyard to the swing even. I would say that's too far. If you have like an indoor swing, if you are like your child is someone who enjoys those sensory things and like they like a swing, if you have an indoor swing that you can, one of those ones that you can stick in the doorway and it's close by, then that's acceptable. But it should be something that's right there on the spot. Ideally something that you can bring into the bathroom with you. Sometimes that's not possible, but it should be as close to the bathroom and the environment as possible. If possible, they also say it should be limited or not available at all even during other times of the day. And their preference is really on like the item or activities not available at other points in the day. Sometimes that can't be completely avoided, but that is the ideal scenario, that they're only earning whatever it is that they're earning for eliminating in the toilet. So it just takes a little bit of setup and some planning on your part. So I usually recommend making a list of items ahead of time that are going to work for you. And you're going to want to assess that each day as you're doing the training, because what somebody wants one day, they might not want the next day. There might not be any desire for them to have that. So you're going to, talk about what they want to work for, what they're going to earn, and make sure you have that list ready to go. And it's something that you're not going to be giving them for some reason, maybe an hour after they're done toilet training. Hopefully for the rest of the day, like you're not going to have to give them whatever that item is. Just another important note, during training time, the toilet should take precedence over all other activities, your toilet training. So, that's important. You don't want to be distracted with having to try to cook dinner. You don't want to be distracted with, having to do work. Like you're sitting at the table and they're playing and coloring. You're outside the bathroom and you're on your computer trying to do something for work. In school, this is what makes it difficult to do something like this for long periods of time at school, because it would have to supersede everything that's going on in the school day. So we usually recommend leisure activities. Many of our kids on the autism spectrum are lacking in leisure skills, so it's a good time to try new things out like that. Introduce things, give them some non-contingent time on their preferred items. So they're outside the bathroom, or like I said, they're in the bathroom playing with those leisure activities. You can do some light academics, but just remember the focus is not on the academics, it's on the toileting for this time. Any sort of augmentative communication system should be present as well if your child uses either a device or a textbook or anything like that. If they're a verbal speaker, then that's fine as well. You won't need that necessarily. But you are going to be doing some prompting or modeling of bathroom requests. So try to have that those communication systems on hand. And then in the beginning, the intervals will be 30 minutes between prompted trips to the toilet. So basically every 30 minutes, you're going to prompt a trip to go to the toilet, whether or not they're showing signs that they have to go. For general procedures, at the beginning of each trial, so every 30 minutes, it's recommended to prompt a request for the bathroom. Some people prefer modeling over prompting. If it's prompting, you're going to take them necessarily with gesture prompts or hand over hand and have them request the bathroom. If you're doing more of the modeling approach, you're going to just kind of take their device and show them this is how you ask for the bathroom, and then push the buttons for them and then take them in. The authors recommend, like I said, prompting, but some people are more comfortable with modeling, so that's fine as well. When entering the bathroom, you're going to have the child pull his pants down or her pants, providing only the necessary prompts for completing the task successfully. So you want to do this kind of quickly. You're not going to go into the bathroom and say, okay, take off your pants, and kind of wait there and then give the directive a second time and say, come on, I know you know how to do this. You want to avoid that verbal prompting and those delays in completing the task. So you go in and just, if you have to do hand over hand, if they're not independent with it, or a little bit of prompt to get them started, just try to go through that kind of part of the step quickly. When they're at the toilet, whether they're standing in front of it or they're sitting, the target range is a minimum of 1 minute and a maximum of 5 minutes. Less elimination occurs prior to that. If they stand to the toilet and it's 10 seconds later they start going, now obviously you don't need to keep them in there for 1 to 5 minutes. Once they're done, then they're done. But they recommend it doesn't have to be 5 minutes, but at least 1 minute. And if you get up to 5 minutes, that's fine. But after 5 minutes, if nothing's happening, then you're going to end the session, or end that trial, I should say. Items that you're using for reinforcement should be kept in view during this time. Or if it's for some reason, you just don't have any place to put it in view, or the bathroom's small, or if it's M&Ms and you're not comfortable having that in the bathroom, visual representation or picture of it should be in view right in front of them. So if they're sitting on the toilet, then maybe you kind of just sticky it up to the wall as a picture, first bathroom, then M&Ms, or first. For some kids, we've had a picture of someone standing up. Meyer Johnson has them, and they're standing up peeing in the toilet, and then it shows that's the first, and then the then would be like the M&M. So that should be in view the whole time. If they're standing up facing the wall, then facing the toilet, then it would be on the wall behind the toilet. But that's important to keep those reinforcers in view. So in terms of your procedures, there's going to be times, especially in the beginning, where the 30-minute interval is up. You bring them into the bathroom with that prompted trial, and they end up not going. So this is what you're going to do. You're going to start off by providing your directive, the SD, whatever you want to call it, in an age-appropriate, friendly voice. There's no intimidation here. There's no stern talking to. They recommend a friendly voice. Okay, it's time to go pee in the potty. You want to avoid additional verbal prompts when possible. So you're not going to repeat yourself over and over again. Think of it that way. You're going to start going, you give the initial SD, and then you want to give it a good, 30, 45 seconds, I would say. If you have to give another prompt, that's when I would go to first then language. So remember, first potty, then M&M, and then, give it another 30, 45 seconds. Don't flood them with tons of verbals. If elimination does not occur by the 5 minutes, then you're going to end the trial. or if it's after a minute and the student is trying to leave, we're not doing anything aversive here. And that's what I like about this program. We're not holding them in the bathroom. If it's, they're 2 minutes in, 3 minutes in, they're not eliminating and they're trying to come out, then prompt the child to either stand up or pull up their pants. And, you're going to exit at that point. At this time, after they pull up their pants, provide one directive indicating that they did not eliminate. Again, it's non-threatening. You're not yelling at them, okay, no pee this time, or something similar like that. And you do not provide the reinforcing item. So even though they may be dry, we're not reinforcing the fact that they're dry. We're reinforcing elimination in the potty. So that's an important step here. No matter how excited you are that they're dry, and that's great that they are dry, but that's not what we're giving reinforcement for with this plan. So there are going to be times when you go in and you have successful trials as well. So when elimination starts, so again, you're following all those steps, that you're prompting, it's the end of 30 minutes, so you're prompting or modeling on their augmented device or with their verbal language that it's time to use the bathroom. You go in, you help them pull down their pants, get ready as quickly as possible, and then they start eliminating. So that's great. This is what we want to see. And you're going to be excited about it, but try not to interrupt it with too much praise or reinforcement. You want to gasp or like, oh, that's great. Because, what can happen is you can startle them a little bit and kind of interrupt it. And then what happens is even though they start urinating, they don't finish and they don't empty their bladder. And that's not ideal. It's not what we want here. We want to have them eliminate until they're empty. So for the first few times you do it and the first few successes that you have, you can give a little bit of praise, and that, that is also recommended the first few times. Just, lightly, just like a little whisper, oh, good job kind of thing, but try not to interrupt them. And then once they're done and they begin to, you help them pull up their pants or they pull up their pants on their own, they flush the toilet. That's when you're giving the reinforcement. They recommend intense verbal praise. That's when you can make a big deal out of things. And access to the chosen reinforcing item can be given. That's when you're making a big deal out. But there is emphasis on not interrupting them while they are eliminating. So you are, especially in the beginning, you're going to see a high number of accidents. So in between those 30-minute prompted trips to the bathroom, an accident could occur. So throughout the whole training, you're going to really be keeping a constant eye out for the accident to occur. Remember, so, you're wearing shorts or, underwear. Ideally, underwear the authors recommend, but I've been successful with shorts. Gray and orange work really well in colors because you can see them turn pretty quickly. But as soon as an accident is detected and it's, you'll see like the things start to change colors. The first sign of any of that, you want to provide verbal redirection, such as we pee in the bathroom. You want to deliver the redirection in a calm but loud tone. And the idea is that you're going to try to startle and interrupt the accident that they're about to have. Immediacy is extremely important. The child should be able to identify that the last behavior that they were engaging in prior to you making that startle statement was the beginning of a urination. So this is one of the teachable moments. You're kind of teaching them that what they're doing is supposed to be done in the bathroom. If you miss the beginning of an accident and you try to deliver the startle statement only when you see like a puddle on the floor afterwards, that startle statement as you move forward might begin to lose its value because they're already done eliminating by then, so it doesn't have any effect on them. Once you see a puddle on the floor, for the most part, they're probably done. So it's a very important part of the program here. So as you're delivering that startle statement, remember, you go pee in a potty, you're immediately kind of bringing them into the bathroom and walking and talking as you go. At the toilet, begin the trial like you would every 30 minutes. Provide your directive in an age-appropriate, friendly voice, just like you would for any of the other trials that we talked about already. Avoid additional prompts and proceed as is. Again, if elimination does not start up and occur again by the end of 5 minutes, then you're going to end the trial. And do not provide reinforcement if they haven't eliminated in the toilet. Again, we talked about this a few slides ago. We're not reinforcing wet or dry. We're reinforcing elimination. So that's how I would proceed with that. So if your startle statement works, so again, you're in between those two 30-minute prompted trials, you start to see sign that the child is starting to wet themselves, and you give that startle statement, and they stop, and you bring them into the bathroom, and you bring them to the toilet, and they start to eliminate, and they kind of finish what you interrupted at the toilet. That's great. That's a big deal. So you want to provide praise and reinforcement, just like you would for any other trial, because like I said before, and I don't mean to be redundant, but it's important to remember you are reinforcing elimination, not the fact that they are wet or dry. So they are going to be a little bit wet because you startled them because they were starting to have an accident. You're still reinforcing if they eliminate in the toilet after that. And again, just remember, in the first 3 days of the program, it's okay to give a little bit of a verbal praise, like good job, but try to wait after that. Wait until they're done so you don't interrupt the behavior of them urinating. So the schedule, like we said, typically prompted toileting schedules are used to start the training 30 minutes apart from each other. If the child is consistently having accidents just before the 30-minute interval is up, it's within 5 minutes, then shorten the interval to 25 minutes. So, for example, if you're finding you're having a delivered startle statement like 26 minutes, 27 minutes consistently, then it's okay to back it up a couple minutes. If accidents are occurring at other times in the 30-minute interval at a consistent basis as you go forward, you can adjust the 30-minute time schedule as needed, but try not to, especially in the beginning. You only want to change it in the beginning if you're seeing that it's happened consistently right before that 30-minute interval is up. Ideally, you want to try to remain at 30 minutes if you are seeing success 80% of the time or more. That's your goal, 80% of success or more. Keep it that way. Don't start lengthening the length of the interval. Not until fluids are reduced, because you're still flooding with fluids, and you're pushing fluids, you're offering fluids, you're giving them fluids when they ask for, within the limits that you talked about with your doctor. So you don't want to increase, go from 30-minute intervals to 1 hour intervals and keep pushing the fluids. You're likely going to start seeing a lot of accidents. So once you stop with the flooding of the fluids, that's when you'll start increasing the length of the intervals. If you feel like you're not making any progress, and accidents are still occurring, so go back, look at those those prerequisites again. Does the child really meet all these kind of minimum prereqs? Revisit the steps of the plan. Check for fidelity. Are you missing a step? Are you forgetting to do something? It has the reinforcement not effective. Make sure you're mixing that up and they're not satiated. Check for interfering behaviors, make sure, and that's one of the prereqs, but, are there any behaviors that have popped up that have kind of put a hamper on things? Or, if you think you've done all that, you can follow up with a additional medical opinion as well. Some other things to keep in mind, like I think I mentioned earlier, a high number of accidents in the beginning is to be expected. And the authors define a high level of accidents beginning as good, because each one of these opportunities when the student is eliminating, whether it's having an accident or in the toilet, these are all teaching trials and learning opportunities. So more of those you have, like we talked about, more likely it is that they're going to be successful. In terms of when, you can kind of say, like, they're doing really well. The authors suggest when you're at 3 consecutive weeks with 1 or less accident per week, and the child is self-initiating, or on an appropriate schedule, then you're taking them, meaning that you take them every 45 minutes or every 30 minutes, and they're dry consistently. They're having 1 or less accident per week, but they're not self-initiating. You still have to prompt the trips to the bathroom. So that part is prompted, but they're independent. Then you can fade the bathroom environment and return to more of a normal routine. So then you can kind of move around your house a little more when they're out of the diaper and things like that. So this is a lot to take on, especially if you're not familiar with these procedures and you haven't done a lot of toilet training with your child yet in the past. We are here to help. I'm here to help. My email, my contact info is here. If you want to start this, or if you have additional follow-up questions, or even if you're doing a completely different toilet training program, and you just have, you find like you're kind of stuck and you're not really going far with it, feel free to reach out to me. We can set up a time to talk. and go over things. And I'd be more than happy to set up a meet or a phone call, and we can go over things. I hope this was helpful for you. There are other parts of the plan I should mention also we didn't really get into yet. There is like nighttime training, training for bowel movements. That's because this is how we would typically start with something like this, and we would focus on the urinations first. And once you have some success with that, then you can look at nighttime training in bowel movements afterwards. But again, thank you for your time, and hope to hear from you soon.